It is 6:30.
5:30.
5:30, still a little out of. So I'd like to call the October 20th, 2014 meeting of the Ayer Board of Health to order.
Madam Chair, I just have one thing. The minutes are not on the
I
agenda.
was just going to say that I was going to add them.
Oh, really?
Thank you. Yeah.
Oh,
And I
you
just wanted to
are
add them.
correct.
If you want to move them under administrative matters,
We,
that's fine.
yeah, we could
I
do
could
that.
get them. I was just going to put them under, but that's all right.
Either
That's
way,
all right.
yeah, that's fine.
Do we have to amend the
You know, I
formal
wonder
agenda
if that's,
to do that?
I'm wondering if that's, I'm really surprised because I remember putting them on there.
They're not on there.
Yeah,
And I
yeah.
actually have
Yeah.
a couple of revisions, which I'm not always big
And
about.
I'm
but
wondering if
Oh,
this
'cause
is
I
an
had-
earlier copy. Let me run up and
It's
get.
all right, because the posted agenda is what's posted, right? And I
Correct.
presume that's what we.
And
Well,
I had-
I'm not sure this
This
is
is not,
posted.
this doesn't have the posting.
No,
thing
so I'm
on it, so
wondering
this
if I
might not
picked up the
be.
wrong one
This isn't the.
posted. Because
Yeah,
I
it doesn't
could
have the
swear.
posted
I'm
stamp.
going to see if I can get to the website.
Yeah,
Oh.
because I could swear that
'Cause
I
I-
put the minutes on there, because we have to sign some tonight. Or,
Well, those we had already approved, but I had you had some corrections because I had.
Just the very first one, because under public input, it wasn't me that offered to contact the state to get more direction. It was Bridget, and it was related to a private property who may not have utility services. And so I'm typically not big on making amendments to minutes,
But was-
except it was Bridget who called me to say she was going to contact
Oh,
the
she
state.
contacted you.
Yes,
Okay.
and that's
Yeah,
all.
that's
And
what I
honestly,
thought,
if I
yeah.
had seen them ahead of tonight, I would have phoned it in.
Okay.
I
Okay.
got my packet on Saturday, so I apologize.
Yeah.
well,
Okay.
we'll
Well,
make that, we can sign that next time, then I'll make.
But that was all I had. It was, and you know what, more just because I didn't do that, and then I remembered just as a.
okay, and I didn't remember that.
That's
that
okay.
you had
That's all
said
right.
that,
I'm
so-
actually pulling up
That
the.
needs to be signed. They were approved last time, but.
Oh, these
I
are the
didn't
ones,
have
yeah,
them.
from September 8th.
You know what? It's just as well. I mean, they're not on the posted agenda either. I'm looking
Okay.
at it.
Wow.
That's all right.
All
swear
right,
I
so
put those
Madam
on
Chair,
Yes.
can I then use this public input?
Absolutely.
All right, so since somehow the minutes didn't get in, I'll accept what Heather just said as a correction on that.
I mean, we can move to accept them as
And-
amended.
Well, but we can't put them because they weren't on the posted agenda,
right.
so we'll have to do
We
them.
can, yeah, we can
the
do them
next
next.
time. So what I would just like to say is that without going into specifics because of certainly privacy laws, Bridget will be out for some time. She
Yes.
had an accident. Do I have to sign it or did I?
Oh, that was due to an accident. I didn't
And
know that.
she did call a town administrator last Tuesday to make him aware that she would be out, so she would be out of the office, and that's fine. And that Jim would assign others to pick up her slack. I would suggest, though, that you contact the town administrator with anything with regards to executive session stuff, and then have him, let him know that Jim Gariffi should be the one that he
Okay.
should contact with anything coming further with any of our executive session material.
Okay.
And she's hoping to be back in the office at Neshoba Associated Boards of Health, hopefully in 4 weeks, and she'll work from there. So she won't be in our office on Monday.
Okay.
That's all. Okay.
Okay. All right. Okay, got it. So next thing on our agenda is draft trash hauler or solid waste hauler regulations. I just want to explain what you have. This is a revision that Oops, actually, yeah, there is no, it says page of 7, but that last page is just a blank.
And I left it on there just so it wouldn't be confusing, because it did refer to the 7.
Oh, okay. You know what? If you just you eliminate that last space, it'll change the page numbering.
I didn't realize it was there until I printed it
Yeah.
out. And so,
Yeah. Sometimes if there's just like an extra, return or something. I don't know if this possibly even the font size could come down a little bit, but I don't think that would actually change the number of pages. But what I did do was, format it according to other regulations that we have. All of the MGL stuff is pulled out. Now, the one thing that I did leave in that is almost a whole page, but I wanted to explain why I did it, is on section 6, the permit application,
Right.
where it states the information that needs to go on the permit. That I left in because of a conversation that I had that came up totally unexpected with a friend of mine who's been on several boards in one of the Bridgewaters. I'm not sure which one. And he had mentioned to me that, and we were actually talking about FDA and how FDA tends to do this, put things in their applications that are not part of the regulation. And he had mentioned that their town had several go-arounds over information that was not, or requirements that were not in regulations, but that were on other forms. And I thought, that's interesting, because I guess the argument could be made that if all of this information is not part of the regulation, I suppose it could be argued that, well, then this is just capricious that you're asking for, some of this information. So I thought what we should probably do, it's probably beyond our scope, is I can highlight this entire section, and when it goes to the town attorney for review, I will put a footnote or somehow a notation there that says, what do you think? Can this just be moved to an application? And if we do that, is there some language that we should be putting in here about the content of the application be incorporated by reference into this regulation?
Which exactly are you talking about right now? Just tell me what
It's
page.
section 6, it's on page 4. And we had talked at the last meeting about possibly moving all of these bullet points, except for the insurance requirements, to the actual application form. But after that conversation, I thought twice about it and left them in. And so this is what I'm saying. I think we should just ask the town attorney, if we take this out, as part of their review, if we take this out, is there language then that belongs in here
Well,
about...
I think we agreed that there was going to be language. It was like it was going to have some kind of, I actually thought we all agreed on that.
Yes.
Was that it was going to say something like, it was going to reference the application within the reg, like because that way if we change the application, we don't have to come back and change
Exactly.
the regulation.
Yeah.
And so I'm,
I think that's all I'm looking for, is that what's the right wording legally to say that the information on the application is either incorporated by reference, or is it better to just leave it in the reg?
And if I might say something, Madam Chair, the more
Yes.
people you talk to, the more diverse opinions. This is the town of Ayer, and
Absolutely.
I think we should agree, and I thought we had agreed on this, that when we come up with what we think the regulations will be, unless I'm remembering it wrong, we would give it over to Neshoba Associated Boards of Health, because
Bridget's already reviewed it. That part's been done.
We haven't got the final one yet.
Yes, she's seen the content of the final one. The only thing that's been done here is formatting.
But we haven't done a final one. We have not agreed on it. Have I missed something? That I
No,
slipped
this
through
has not,
something?
all I'm saying there is that the content of this document has not changed from the version that Bridget reviewed and said she was fine with.
Okay.
The only thing I've done is to put it into the format that we use for our regulations, which is this header,
Because the last time we
footer,
did
the
take
font.
stuff out that we
That-
said belonged in the application.
That's the section that I'm talking about right here.
The
That-
whole section 6.
Yep. Well, not the whole section 6, I think 6.1, the information that, these things that
All the
we
bullets.
want, yeah, all the bullets.
And I thought we had, you're right, I thought we had agreed on that last time.
I don't, well,
What's
What-
your recollection, Heather?
did.
Okay.
we did. You're absolutely right, we did. And I guess what I'm asking is, can we reconsider that and ask for a legal opinion on it, because it is somewhat of a legal matter?
As you know, I said on the first one, I'm against sending it to legal. These are regulations. We have never, ever sent a regulation to council.
There's
And-
information in here about requiring insurance, requiring indemnification, and we would be absolutely foolish not to have
Well,
a municipal attorney look at this.
So my question is, at what point do we send it to council?
I
I mean, we
think,
agreed that DEP would take a look at it too.
Yes.
And we haven't gotten there yet.
no, but I
so-
think that DEP and town council can go concurrently.
I don't, I
No.
think that I think they need to go one after the other, because DEP may, because legal is going to look at it, exactly what you were saying.
Yeah.
Indemnification, insurance, they're not gonna look at it in a solid waste capacity.
I see,
Exactly.
yeah, that makes sense.
So I think it should go to DEP, come
Okay.
back, and then, and then what I think, and I'm only gonna give you my opinion on this, is that, it needs to go as written here. If we can all, if you wanna wait to get council's opinion on this, if it's going to council anyway, and I don't disagree with your question about sending it to council, because it is a brand new regulation, and we are indemnifying, and there are certain things in here that don't hurt to have them look at, to make sure that we're not borrowing language from another regulation that may not be legal to do or otherwise. Because the permittee agrees to indemnify the town of Ayer for any liability. I mean,
Yep.
So there may be concerns with some of that language, but I think at some point we have to stop changing it and send it to DEP.
Yes,
And I want to see DEP's changes before they're accepted.
yeah,
So
I think
basically,
that makes
if
sense.
I'm understanding what you're saying, and I agree with you, if we come up with what and I thought we pretty much had
Right.
done that the
Yeah.
last time.
Yep.
And then, if there's no changes, or if Bridget has already approved it so far, then DEP, because as far as this, the only thing town council, if you're concerned on, is going to be the insurance and the
Right, and the
indemnification.
Yeah, I agree.
The rest of the regs, no. So perhaps when it goes to town council, should be highlighted with that
Right,
specifically.
the areas that we
Yes.
noted of significant, because DEP is going to do a review of this and mark it
Yeah.
up.
Yeah.
So, but let's give them a deadline, because we need to work on a deadline. So if today is the 20th, our next meeting is November 10th. I mean, it would be fairly aggressive to ask for it back by November 10th, but we could. I would almost
say it's
lean
worth a
on
try.
Irene Congdon, right?
Yeah.
Because I would send it as an email,
Okay,
as a Word document,
Yep.
and ask for a review of it. And I would actually ask her for, and I'm just looking at my phone to look at my calendar, just for the folks watching from the comforts of their home. I'm just using my phone as a calendar. So November 10th, so we could ask to have it back. I mean, it could be put on the agenda for November 10th, and if we don't have comments back,
yeah,
we can just push it out to the next meeting. But you could give them a due date of November 7th, just to have it back by that Friday. I mean, I'd like to
That's
see
true.
it before the meeting, but at the same time, that would end up cutting it a little bit shorter. Actually, no, I'd be aggressive and ask for it back in 2 weeks. 2 weeks is Halloweeny.
You're not going to
November
get it
3rd.
back.
You could say November 3rd, and she could say if she can't do it by then.
Third is that
It's a Monday.
the Monday.
That's 3 Mondays from
Yeah,
right
that's
now.
3 weeks.
So you could ask. I'm sorry, that's 2 weeks from now.
You're right, it is.
But if we send
It's
it
2 weeks.
tomorrow.
Yeah.
You could be aggressive and ask for it back by November 3rd.
And I send it
And-
to whom?
Send it to Irene.
Irene
Condon.
Okay.
Yeah.
As a Word document.
Yes.
I actually believe it should come from you
Okay.
as the chairman with
All right.
a definitive date and a
Okay.
request for action.
Okay.
And I don't mean that in any disrespect to Jane's writing skills. I mean just as the elected chairman,
That's correct.
Yeah, that's reasonable.
your request for action by November 3rd,
Okay.
so the board can move forward maybe.
Okay. So I will request vision.
And if she says she can't, then simply we'll just wait until it comes back to have it on the agenda. Do you know
Yeah,
what I mean?
what I can do is check in with her. You know, we get the agenda out the Thursday before. I'll check in with her like later on Wednesday before
Yeah.
that
Okay,
to
I
just
can
see.
make a note
Do you think you're
to-
going to have it back or?
Right.
Remind you.
Okay.
Yeah.
Yeah, that would be great.
If you send it, I mean, I don't know what your morning is like tomorrow, but if you sent it tomorrow, you'd be giving her almost a full 2 weeks.
Yeah, I can definitely do it tomorrow. I can probably do it tonight.
Yeah.
Okay.
And you know, you could always, you know, I mean, obviously she's an advocate for solid waste
Yeah.
control and right, you know, as far as what she does. And so you could just let her know that we've been working on it and that we would appreciate her review
Okay.
by that date. Good.
Now,
All right.
Chair, when are you, or have you thought of a date for a public hearing, or you haven't thought of it yet?
I haven't really, just because I don't know. I've never sent anything to DEP before. I don't know how long that's going to take. I don't know how long town attorney is going to take. I'd like to get it in December, but it's
not a
probably
month
not
to
going to
have
happen.
Not a month to have a public hearing. I can tell you that right now.
Yeah, and I don't
because
think
it's-
realistically
No.
even the schedule is going to come together by then.
Because it's the holidays, people are doing too many
Yeah.
things, and even if you
That's true.
attempted to get, and there may be people that will come to this public hearing, and I
Yeah.
just don't think the month of December is a time to
I
have
think
it.
unless we can get it for that first meeting in December, possibly, but
I still-
that's going to require an awful lot of things to align
Well, that's-
properly.
You know what? That's
Yeah.
that's aggressive.
Yeah,
I
it is.
appreciate that.
Absolutely,
Yeah.
it is. So we're probably
Okay.
realistically looking at maybe first meeting in January.
Probably not at that time.
Okay.
Okay. And I can even ask Irene for her opinion on, you know, she must see an awful lot of these regs, and what's her opinion on putting application information in. She may even be able to provide me with the right wording to incorporate by reference, and then it may make things a little bit easier for the attorney if they're just reviewing things that we've already put together. You're not having to write anything. Okay. All right, thank you very much.
Okay.
So for new business, a couple of things. We wanted, I think this was Mary's suggestion, and this was a very good one at the last meeting, is that we should really start talking about what are our future goals, what do we want to accomplish in 2015, what are our budgetary requirements going to look like, is the
FY16.
It's FY16. I'm saying for
Yes.
calendar year,
Yeah,
right?
it's FY16. I know, it's
Yeah.
always confusing.
I
'cause
know, I know,
it's
I know.
calendar year 14, but we started FY15 July 1st.
Yes,
So
it's
I brought
actually
it up to
16.
think of FY16.
You're right. You're right. So I think for that, I don't know if any of you have anything off the top of your heads. I definitely would like to get a copy, you know, of our budget from last year, which you may have, you know, our current budget, yeah, which is up there. And so if you could just throw copies of that in the meeting packet, and if it should be, I think she had I think Deb had a folder for budget. I'm almost kind of envisioning it in that
Okay.
right-hand lower drawer.
I'll
If
look for it.
not,
I can find
you can always get it from,
Yeah.
like, Lisa or whomever.
Yeah,
Okay,
I'll
great.
figure it out. I think there is. I think I've run
Is
across
there
it.
anything in particular on anyone's mind that you're thinking that we should be? I mean, for me, it's upgrades to the website and getting some better links, getting some more information on our website. I know, Heather, you had mentioned
Yeah.
you had
it's
some
not gonna
ideas
cost any
about
money,
layout.
though. Right. I don't know that we're not stuck to that layout.
I know.
Tends
It
to be like a
seems to
template.
be a template, yeah.
Yeah.
But that actually would be something else, Jane. If you could just, next.
find out.
Yeah, find out if we all have to use the same template or no.
Are we wedded to the
Yeah.
company website or the template?
Yeah, the town,
Because sometimes
board
when you're
website.
doing that, you can change, change that template for certain pages.
yeah, and I'm sure we want to keep,
So-
the information up at the top, the
Right.
logo on the town hall and
Yeah.
all that. But as far as then arranging the page below
But we
that,
may
yeah.
be able to have a little liberty
Okay.
with what's below.
All right, that sounds good. So I guess that actually is some good homework to look at. And I'm looking at this as not only things that have budgetary impact. I mean, of course, we do want to capture the
Sure.
things that have
Yep.
budgetary impact, but what also are some of the things that we'd like to accomplish as a board coming into a new year, a new calendar year? And go ahead.
So I did do some homework. I actually pulled Mass Department of Public Health Health and Risk Behavior Survey for youth. They do it every 2 years. They work with the Department of Education. And what they do is they take a sampling of about 150 schools around the Commonwealth. And basically it's a survey. These kids, they all do a group survey. And what I was able to pull, and I can actually get a copy for the board, is kind of their aggregate report that just gives basic numbers, but the executive summary is very telling in that a lot of the higher risk behaviors from 2011, 2009 are down. I mean, I don't want to say significantly, but down in anywhere is good, And so just looking at the executive summary, this was done in 2013. The report
Okay.
was published in May of 2014.
Okay.
And they did it before in 2011, and then 2009, and then 2007, probably years
Okay.
before that. But when you look at the numbers, they're telling. And so I'd like to actually have a chance to kind of digest it more and see if there's anything here that we as a board may want to focus some additional kind of programs, whether it be something with the school or with the nurses, at Neshoba
Yep.
Nursing.
I like that one.
I think the idea
Yeah.
that the nursing service, sometimes I always feel like the nursing services are underutilized in the towns, because I know they do a lot of home visits, but I don't think that now that they have a social worker that's working with them, I think that they probably wouldn't shy away from an opportunity to do maybe a little more community engagement. And so, but I just wanted to take it out to kind of digest it. It's a lot of numbers, but I can get a copy for
Yeah.
all of you. It's a great report. I pulled it off. I taxed my color printer
I
earlier this
guess.
weekend, but
Wow.
there were some things that
Some
kind
nice
of
color
stuck-
there too. Wow.
There were some things that really did stick out to me. Was that the bullying, of course, is in the
Yeah.
news, but what I found was through this survey, it seems the middle school numbers are higher with the instances of bullying than in the high school. So, there may be something, the schools put on programs, but would
Yeah.
it be a bad opportunity for the Board of Health to not partner with the schools on something? It would certainly be a nice little burst of community engagement for us. Because people know the Board of Health as being the food and the Shepley Hill and flu shots. But the other
Right.
side of it is that we could really make our mark in that. And then the other one that I saw was in mental health and suicide. Those numbers are still pretty
Yeah.
telling as far as suicide goes.
Yeah.
And not necessarily suicide itself, but thoughts of suicide, seriously consideration to suicide. Just looking at those numbers and knowing these are kids these are middle school kids.
Yeah, middle school.
And so there might be an opportunity there. Maybe there's, some you hate to give kids papers to read, but maybe there's something a little bit more engaging.
That's a great resource, though.
So I just wanted to take a little more time to read it
Yeah,
and
that's
maybe give you guys a copy of it to digest it. But I've been looking for it for a while. It took me a while to dig in and find it, and I found it last week, and I did print off a copy. So
You can just send me a link
Okay.
to it. You don't
All right.
have to spend another ink
Yeah, no,
cartridge printing another copy.
But when I looked at just at the executive summary, when you're just looking at, this is percentages. So when I say it's a percentage, but current alcohol use went from 46% in 2007 to 36% in 2013. So that's 6 years, but that's still a drop. It's not like we've
is.
seen an increase. Now again, this is self-reporting by students,
Yeah,
so there's
yeah.
probably a little margin there, but. And again, some of the numbers are still the same around mental health and such, bullying. They all kind of tend to sometimes go a little bit more hand in hand, but
Well, and we do still have the e-cigarettes, e-tobacco, alternative products
and
that I
it's
need to
funny
get a hold of
is
Joan
that there
Hamlin
wasn't
for.
much in the way of cigarette use. 18% reported having current cigarette use in 2007. 11% reported now.
I've been reading that too in the paper.
And so
that it's going
again,
down.
it's self-reporting, so there is
Yeah.
a grain of salt
Yeah.
with that. But anyway, it ended up being, I think that the numbers were about 3,600 middle school kids were sampled, and in the high school it was about 4,000 kids. So I'll get a copy for you.
Okay, great. And what is that? It's health and risk behaviors.
Health and risk behaviors of Massachusetts youth.
Yeah, if you just send me a link to it, that would be great.
I don't know if the region has ever done one, because I know when I was in Acton, they did one in a region though, so it was Acton, but a group of other schools as well. But anyway, okay, that was my homework.
Okay.
I wanted to mention in your file, there is in the mail file
Yep.
there is a grant application from Emergency Preparedness.
Yes, which is why that is.
Timely. But I also wanted to add, if I could, to what Heather was saying. I scan, I get the email every day, and the National Institute of Health and their counterparts at the state level are really getting into behavioral stuff.
Right.
Like
I know.
boarding, like eating behaviors or eating issues, to name two, and and providing growing resources for help with those kinds of things. So if you like, I could pull stuff together and see what they're offering on the state level.
Well, I am interested in
Can I
the.
see that grant?
Oh, yes,
While you're
actually,
on
I
the
was going to send that
subject
to you
matter.
because that's
Yeah.
something I view as being more
Yeah.
your
Yeah.
area of expertise. But I am interested in the hoarding. I think the
Neshoba Board of Health is doing
right. The person that they have working with them, the social worker, is kind of a specialist in hoarding,
that. Well, she's working with that.
or is working with that. Do you know? And I talked to Bridget a little bit about this once. What I still struggle with figuring out how kind of personal privacy and public health intersect on things like this. And is it correct that if you believe that there's a hoarding situation, you still have to get a legal order to go in to actually look at what's going on in the home? Is that correct?
Did Bridget get back to you after her phone call with the state?
No.
Oh, well, she might have had her
She might have, yeah. She might have.
You still have to knock on the door. The person has to let you in.
Correct.
If you have
Right.
cause, you have to have cause to believe that the person is putting themselves at risk, and then you have to get an administrative warrant.
That's what I'm thinking.
But you
of.
have to have cause, and
Yeah.
I think that cause is But I would yield to Bridget because I know she had a discussion with the, basically the state sanitarian is kind of like,
Yeah, yeah.
so. But the ruling on that is you do need, knock on the door. If they let you in, great, but you need to tell them why you're there too. So,
Yeah,
you know what, there's
yeah,
a lot of it
yeah.
that we pay somebody to know as far as
Yeah,
professionally.
yeah.
And so, but you do have to say, you know, I'd like to come in, I'd like to take a look around. And if they say, you know, you have to tell them what could happen though if you go in. You could say, if I find anything wrong,
Right,
understand that I
right.
might cite you, and they can choose to not let you in at that point.
I did have that kind of very general discussion with Bridget. It was several months ago about, well, what I actually asked her was, you know, I said, you see on television that television show orders, and you know, the person comes in and they're from the city health department, and I said, what's with that? And she said, well, first of all,
It's
scripted,
television.
right? But she said, beside that, if there's, you know, if you're going into someone's house as, you know, a board or, you know, some sort of an official, yeah, if that person doesn't want you there, there has to be some kind of, you know, court order, and that's the administrative order that you're talking about, right?
Right.
Yeah. So, yeah, I do find that, and that would be an interesting thing to try to find out from the showbiz. Do they have any guidelines on what are trigger levels, or, you know, when do you act on something? I don't really know.
Or at what point do you offer services and say, you know, maybe not go in and barge in, but say these
Yeah.
are this is what's available, this is how we can help you or whatever.
Yeah,
We had something like that.
I think the whole hoarding thing is a very sensitive situation too, because I think to someone who is into that behavior, you don't see yourself as hoarding, or I think that you're just not, it's not registering what's going on. So keep this one in mind. I don't know.
It
if
doesn't make any
we-
sense to me. It looks like it's missing a bunch of stuff from there. I don't know what any of that means.
I
Did you see
think-
the second page?
Yeah.
It's a blank document.
Yeah,
just
I
don't
think
it
she's
was-
just-
That's just the.
Yeah, I think
that's
that
the
she's
whole-
just
was the whole
saying,
thing.
you know, if we have any requests for anything related to,
No.
Yeah. I'm
which
good.
I don't
Well,
know.
we're
if
good.
we
We
do.
have
enough.
tons
And we have
of
plenty of
stuff.
radios.
We have
Yes.
plenty of
Yes.
everything.
Yes.
Yeah.
Yeah. There were
Okay.
some towns that took full advantage of that stuff when it first came out, and there may have been towns that did not. And I
Okay.
think that, you know, perhaps we have a lot of people.
We do.
Okay.
We do.
And you don't feel like there's anything
No.
major lacking? in
I
our-
do
okay.
not.
All right, that's fine. Okay, do we have any materials from Bridget?
Yes. It's all in the.
It's all in here. Okay.
There.
All right, then, let's pull out
And it's
the
towards the back, I think.
Bridget
And there's
information.
stuff with, that's all put together.
All right, so let's look at what we have here. Public outreach. No, that's not.
There were a bunch
Test.
of,
Okay, here we go.
did you get them? Yeah.
I will be
It's
attending.
this stuff. If I
Is
had
this
to guess.
you? You will be attending?
Yeah.
Oh, okay, all right, got it. Okay.
If it's just routine
Yeah, if it's
approvals,
just
I don't
permits.
need to see
Looks
that.
like
That's,
these are just,
those
if
are
it's
just
just permits,
routine
I don't
every
need to
year
see
that
'em.
she renews them,
these are all food permits?
Yeah.
Is that right? Okay.
because they run
I
out
don't
the
need
end
to
of
see those.
October, I believe, so.
Yes. Yeah,
And
they
then
do.
there were some things in there that need, from other boards that needed to be,
Okay, we can look at that as part of the mail review. No further inspection for walk and roll?
I called and she didn't get back to me, so,
Because I do see that they're one of the,
Yeah.
well, I think
Yeah.
everyone gets relicensed on that
Yeah.
schedule, right? Okay.
so I don't know what the deal is. I did have a call into it, but because of
Okay.
what happened.
Then these just go in the,
Yeah.
you know, in the
But I did
company
follow up
files.
on that.
All right. Okay, and here's another dog bite. Did this dog bite go to Carleen
Yeah.
already? Okay, got it.
Perhaps you could,
I think
Okay.
so, unless it's something that I got mixed up in there and I didn't see it.
No, I think it's the one that I looked at. It's the bite to the mouth and face.
Oh, yeah.
Yeah.
No, she saw that.
That was good.
You know, did she get the barn book? Did she
Yes.
get the- Oh, good.
Yes.
That's good. Excellent.
perhaps you could see, Madam Chair, if you
Yes.
could, email over there, I'll find out if that review was done, that
I will.
follow-up that
Yeah,
bothers
that's
me.
why I was asking.
And I
see
think
what's-
she had said Kayleen would be acting in her stead,
I
so we
think
could
she
call
will.
upon her. I'm sure she would be.
Find out if it
Okay.
went.
Okay. Could you check, Jane, just when you're in the office, either tomorrow or Thursday, and email me the date of the most recent walk and roll inspection,
Okay.
so that I can reference that?
I don't think we've had anything since that time when we discussed it, do you?
No.
I believe it was
Yeah.
August, I think
But
you're
you
right.
just want to reference the date.
I just
for
want to
your-
reference the
yeah.
date, exactly. Okay, all right, so those are just to file then. Anything else for miscellaneous new business, or perhaps I should take a closer look at the mail, maybe there's something in here that, oh, okay.
I wanted to draw your attention to, I think it's in there, among the mail, I got a form from, a hospital in Boston about a dog bite.
Yes,
And I like that form very much in that it shows, it does mention rabies and stuff on it.
it's a great form.
And I thought, maybe we need to, I know we've talked about this before, but one of the problems that I see is that there are a lot of loose ends administratively when somebody gets bitten. And it would really help to nail some things down if the forms we were receiving were a little more explicit.
Yeah.
They're not our forms, they're hospital forms. We
No,
have
but
nothing to
I-
say about hospital forms.
We don't, but we could ask the hospital. This is something.
We could have a workshop perhaps and show, what some of the things are that we need to have or would like to have. And
Well, the only thing really that I don't think would be a tremendous burden for them, and we could ask for, they may still say no, is the name of the animal, if it's known. Because they are asking the person for a lot of other information, the address, who's the owner. And it would make it a little bit easier on Carleen when she's looking at the list of dog licenses. Because I noticed this came up when I had one this summer, where if you have multiple dogs licensed at one address, they're not all on the same vaccination schedule for rabies. So that's one that I don't think it would hurt to ask.
Who are you
Neshoba.
asking?
I would just Neshoba.
I know, but we get reports from hospitals all around the Commonwealth if somebody was bit and they live in town.
Everybody's forms seem to be a little different.
Right.
And that's what,
I think it was that.
that's the one from
Right.
Boston. Now, it's
Yeah.
a form that's put out by the city of Boston.
Right.
Our form.
I've seen ours. It
that we
looks
get from
just-
Neshoba.
Almost just like the one that gets sent over when I was in Acton from Emerson.
Yeah.
It's
So it's
very
just,
simple because, all they're required to do is report the bite.
yeah.
That's right.
That's the only thing I would even consider asking them to do, is could you add a space for the name of the animal, if known?
Do you have one from Neshoba?
I do. I think there is one in,
Pam, while you're doing that, I just looked, that was
Right.
August 25th, the walk and roll.
I knew it was
ooh, thank
August.
you. 25.
I knew it was August.
Wait time, we need another one.
Yeah, definitely. There was one in here that I just went past. Where did it go? Inspector. Did I clip it back to
On the
this?
back.
Ah, there it is. Yeah. Now, in this case, we got the name of the animal
Yep.
only because they didn't know the name of the owner.
Okay.
Yeah.
So,
So it's got the person bitten,
yeah.
which is who we need to know, and we have at least the,
Usually we get the
The
owner.
owner.
We usually
and
do.
so what is, and I apologize, I don't mean to ask this question, and I'm not trying to sound obtuse, but what's missing from here?
The name of the animal, if it's known. A lot of people know the name of the animal
Okay.
that bites them. If they don't know, they could easily just write NA. And the reason for that is that when you're looking on the town clerk sends
Yeah.
out that list
Yeah.
of everyone who owns
Yeah.
dogs and
Yeah.
their rabies
Yeah.
status. You
So
can
the
have, if you have multiple dogs at an
Person-
address.
Right. I understand that.
Yeah.
Thank you. Yep, you clarified that.
Okay.
So this is because this young woman went to the ER. That's why this person from Lunenburg went to the ER at Neshoba Valley Medical Center.
Yeah.
And they're saying, well, I got bit by this dog at X. And they may or may not have all of that information because
That's
they
correct.
got bit by a dog.
That's correct.
So you're asking the hospital to do that?
I'm asking the hospital to just ask the person, do you know the name of the dog? If you don't, no problem. Draw a line.
If you want to have that discussion with an ER nurse, you can go right ahead. But you could, but
That seems easier to me,
but
actually,
what if we
than
get
knowing
one
the
from
address.
Emerson? Right, Emerson.
I don't know what Emerson's forms look
They
like.
all
Do you
pretty
remember?
much look the same. I mean, I don't know that knowing the animal's name, knowing the owner of the animal is probably more relevant. Because she's going to make a phone call to the owner regardless, right? And
That's
the
right.
owner's going to know who.
She
So what is-
may or
what
may
is-
not. If the
She
animal's
doesn't call the owner
current,
of the dog?
if the animal is current on its rabies, then I don't remember exactly. I don't think it's a quarantine issue, though, if the animal is current on its rabies.
Okay.
And that's her
And so
hunt.
she just does it by looking at a sheet of paper. She just looks
I think
at.
she can.
That's what I mean.
But I don't
Okay.
want to speak
All
out
right.
of turn.
So what I would caution you on is you can ask the Shelby Valley Medical as a good
Mm-hmm.
neighbor to ask of it, but you're going to get forms from every other hospital and they're going to do it however. If
Yep.
you wanted to ask our
Yep.
friendly neighborhood hospital, but
To me, it sounds like an easier question to answer than the owner's address.
well, the owner's name is probably the more.
Yeah.
I
But,
don't know. I guess I could argue both sides of it because ultimately you're going to contact the owner, I guess. But I guess maybe
yeah,
not.
you are.
You can make a pass at
any
it. but
objection
I
to
would-
requesting?
I would probably, if you were going to approach it, you may want to approach it in a, don't make a phone call. You could make a phone call.
Yeah.
Or ask to speak to the secretary for the department, because you're certainly not going to want to speak with an ER nurse. They may just hang up on you.
Oh, yeah, most
But
definitely.
maybe like if there's an ER administrator or
Yeah.
something. But I would also just, if you explain the reason,
Absolutely. Yeah, I think
and
they
they
do
may
need
say
to know
we're not
why.
required to, and they might
Yeah,
say thank you very
absolutely.
much and hang up the phone.
Yeah, and if they
All
do,
right.
I would accept that.
Okay,
That's not,
that's
it-
fine.
it's not anything I'm going to
Yeah.
battle with anyone
Yeah.
over it, but I
Yeah.
think it's worth
Okay.
asking. We can also take a look, Jane, at some of the other reports that we've gotten from, just see what are the other hospitals that we typically, I know we had one from Fitchburg or
That's what I mean,
Leominster.
is, it doesn't stop at the town line.
No, it
certainly.
doesn't, but I know an awful lot of our reports are coming from
Yeah.
from the show.
I
So
also
it might
know
hurt, yeah.
that sometimes it's a lot easier to get the information that's pertinent at the time that, if you have a form, if it's there. And one of the reasons why you want to know the specific animal is you could easily get into a situation where a person may have 2 dogs, and the person was attacked by one of those dogs, and down the line there might be some legal stuff. And you might want to be very clear as to which dog it was.
Yeah, I mean, I'm thinking through even.
And I think that it's always good to get information up front because it's usually easy to get. And
If I'm running and a dog hits me, bites me, I am not going to stop and ask what the dog's name is. I'm going to go to the emergency room and tell them the address.
That's right.
But an awful lot of people know the name and address
I know.
of the owner.
I know.
So that's why
So
I
that's,
think they might.
honestly,
Yeah.
take it up, and if you want to try to get that,
And if you,
No,
that
but
brings
they'll
up
ask
another question.
if they can't.
I have about this, is if you're out running, Heather, and you get hit by a dog, and
hit.
Hit,
bit,
bit.
Could be
Yeah.
hit by
It could
someone
knock you
else.
down. Mine,
yeah, it knocks you
mine
down.
could do that.
If I get bit,
Yeah.
I'm not going to go look for the owner right away. I'm
Right.
going to get myself
But
to
what
the
are your,
right.
in Ayer, do we have any bylaws dealing with what you do? What are your?
Well, we have a leash bylaw that your dog has to be
We have a
on a
leash
leash in
law,
public
that's
places.
right.
And that is a bylaw.
But what are the ramifications, what's the fallout for the dog's owner if it's unleashed and it attacks somebody?
I believe according to the bylaw, there's a fine associated with not being leashed. I don't know that the bylaw, it's a very short section in the bylaw. I don't think it says anything about an attack.
Because in some places, it's
I don't
like,
think, I could be wrong.
you know, if a dog attacks somebody, there are grave repercussions, you know.
There is some state terminology around dangerous dogs, and I believe that would be the animal control officer
Well, I was
that
just going
it
to
would
say,
go
your
to.
phone call you got right before our meeting is a dog running up and down a street, so that's
Yeah,
clearly
that's
something
definitely
that-
animal control.
Animal control, so,
Yep.
all right. Great.
All right, let's get
Okay,
on.
so other mail issues in here, we have the letter that went out to the person on Jonathan Drive about the chickens. Do you know
Yeah.
how that?
I haven't talked to
Resolved
Carlene.
itself.
I think that was on
Okay.
Thursday, so.
Okay. We did send out a letter, Carlene, when she was doing a bite inspection at 18 Jonathan Drive, noticed chickens at 12 Jonathan Drive. So we sent out a letter just telling the person that they have to have a license. Don't know what came of that.
And I haven't gotten money back from them
Okay.
or filled out forms, so. yeah.
We also got a very interesting email on Friday the 3rd from Vitasoy, from Peter Breed, saying that when he arrived at Vitasoy at 7:30 this morning, I noticed a slight smell in Westford Street above our plant. In reviewing our system, we identified and corrected the bleach pump as the root cause. It was underdosing the tower due to a mechanical issue. It was corrected by about 8 o'clock. Checked the stack twice since the work were corrected. Smell was not present when he left at 6 o'clock.
Excellent.
I love it. And we received no
No.
calls from residents on
No.
that, right?
No
That's
calls.
awesome.
Excellent.
And I sent a copy over to the DEP.
Okay, got it.
I copied them.
All right, the coffee roaster, did they,
Yes, they haven't signed a lease or anything yet. They're,
yes, did they get a hold of, did you the ones that
I just wanted the coffee roast.
are,
yeah,
they were going to deal with Bridget,
Neshoba.
so I assume
Yeah,
that if they call
yeah.
back, they're gonna get, okay,
Yeah.
got it.
Can I see that after you?
Yeah, here's the rest.
No, no,
to
I
the
just
mail
wanted to
pile if
see
you
what
want.
you,
and they're
whatever you-
they're hoping to go in where the Natural Cafe was.
Yes.
And they don't have a name or anything yet.
Town meeting warrant. What's that? Okay, mesothelioma. Yep,
Do we have any bills?
No bills.
no bills.
How happy is that?
I will share with you, we had a coffee roaster in Acton, and coffee roasting is far different than brewing coffee.
Really?
You're roasting raw coffee beans. It's a whole different
Yeah.
level smell experience. So
Yeah. Right.
it's not that,
Interesting
it's
point,
not
yeah.
the pleasant odor of your morning coffee brewing in your kitchen.
Yes.
It's a raw to roasted bean is a we found out about it in South Acton because of odor complaints.
So it's an unpleasant.
Well, it can be
Can
if
be an
it's not
unpleasant smell.
vented correctly and managed correctly. So
Okay.
Bridget can handle this, though. It's not for us to handle. I'm
Yeah.
sure she can handle it as far as regulations go.
Do you know if there are any regulations unique
It's
to
odor. I
roasting
mean, it's air
versus-
control. It's
Okay.
air pollution control. You're basically managing. I don't know the full extent of it from this email, but
Okay, it sounds like they're with the right person though with.
well, and now that Bridget's
Bridget.
out, though, you may want to send a follow-up and make sure they speak with somebody else in her stead. If Bridget's out for 3 weeks, the poor voicemail will be full. It was a
Is-
quite nice establishment once they got everything up and running.
Is this person, 39 Central Ave, that is where the business would be? Are they in the aquifer protection? Do you know?
I don't know.
What are
Okay.
you talking about?
Because he has nothing circled. There's someone at 39 Central Ave that looks like they have submitted to ZBA for a home occupation
Yeah, those just came in today. And
For
I-
what,
I
Pam?
for
normally,
cutting and fabrication of granite to be used for kitchen and bathroom countertops.
In the home?
I guess.
I think it's a business, isn't it?
Is it a business location already? Russell Dean, R&L Stone, I don't know.
And you said 39 Central?
39 Central Ave.
Well, isn't Neshoba Associate Board of Health is what, 31?
Oh, okay, I wonder if it's the
It's
building
gotta, no, there's
that's...
30, it's gotta be on the other side because 76 where we're building the Habitat is down on your left. So it's on the other side.
Okay.
What's the number for John's medical marijuana? That
I'm not
might be
sure.
31.
I'm not sure.
I think you're right.
And this is,
It could be where the Madigan,
No, it
Place
might be down,
was.
it might be,
it's not far, it's in that area somewhere.
yeah, well, this
there's an
one we
automotive,
really,
there's an automotive facility down there. Is it maybe adjacent to that building?
I don't know. I'm just gonna put a note here for you, Jane, to check.
And they need a
Yeah,
review
for
from
sure.
us?
Check to see where it is.
Yeah, check and see if they are in Zone 1 or Zone 2, well, probably not Zone 2. Are they in Zone 1 for the Aquifer Overlay District?
I'm gonna look up a map.
Ooh.
See, we need to be like, I need to be like our
Yeah, exactly.
brethren,
You're
brethren,
archivist.
39 Central. Because if
39
they're asking us for a review, I just want to be able to say where it is right now, so we can all know that it's not a residential home, but also that it's,
Yeah, that's crossed out. It was originally checked for home occupation. That was checked, and now it says a special permit to expand, alter, or change a non-conforming use or structure. But they do have it as zoning district
it
general
is the
business.
Central Ave Auto Repair, that building. It's, I just happened to look it up and it keeps showing me Central Ave Auto Repair at 39 Central Ave. So it is it is that auto repair shop on Central Avenue.
It's not Central Collision. It's
No,
not that
it's
far
the
down.
Central Avenue,
Is that right on the corner of
Are you talking,
Groton Harvard?
it's not Sealy's, is it?
No,
This is
no,
up
no, This
closer.
is further up to here.
It's in the gray building.
Yeah.
Yeah.
So there's like an auto
Oh,
repair.
okay, I
there.
know, yeah, I know
So-
what you mean.
It's there.
It's a business anyway
It's
in
a
there.
business in
So
there.
I don't really
Well,
see,
it's saying that they're expanding, altering, or changing a non-conforming use or structure, and there's not much else.
what, are they
here for
changing the
details.
building? I can't imagine they can change the building.
Pursuant to Ayer zoning bylaws, section 4.4, table 5.2.
Wow.
I'll take a look at this one tomorrow morning
Okay,
when I come in, okay?
all right.
And it looks like that's all that we have in there. So that's mail bills, administrative assistant update, if we have no bills.
No bills, but, last week I sat in on the,
We can have this back.
group, state talk about Ebola, which was very interesting, and, I got the phone number. I mean, the whole thing, was all about,
Sorry, I took that.
you know, setting up protocols and things, and they're still in a state of flux, and that was very apparent. And I think this week, and I'm following this, things will be a little more nailed down than they were last week. But we do have a phone number,
Okay,
so that was probably the biggest thing, and I made a note of it.
Now, you got the email last week, right, from Robert? Mary,
Yes.
did you get a hard copy when the conference call was offered up?
No,
Yes.
no, I did not. She's asking me, did I get a hard copy? And I
No.
said, no, I did not.
No, because I didn't see it until today,
Okay.
so.
Well, yeah, Robert did forward it on to us, and
Yeah.
so, I would certainly, I don't know that it's anything local Board of Health needs to, you know, keep our ear
Yeah.
to the ground on, because we do have our Neshoba Nursing Service, and their primary task is to advocate for us. And so I would certainly, I couldn't call in that afternoon, or actually I would have, just out of curiosity to see. I think that, at least from what I had read, and only from what I read on the news, so it's not qualified Board of Health information, but I think they did it just as a way to address, the Commonwealth felt it just
Yeah.
as a need to address it, that we know it's there, we know there's precautions in place.
yep,
I didn't take it as any imminent threat,
Right,
the conference
right.
call in and of itself,
Yeah.
so.
and I
Okay.
think the approach is even evolving as we speak. I know, Jane, when I spoke to you after the call, they had told you, I think, that the model at that point was going to be to have local hospitals
Well,
doing
that was
treating.
one thing.
I just read in the paper today that CDC is now going to
Well,
specialized
specialized.
centers,
Well,
so,
they're-
So that's the.
I think it's still
in a
evolving.
state of-
The
it's
risk you
evolving.
have is
Yeah.
a media that's quick to go to press with information that's not validated.
Yes.
Yeah.
You know, I
Exactly.
actually read probably the best article I've read in the past 2 weeks, is that we should be more concerned about the flu at this point.
Absolutely.
Yes, exactly.
And not lose our focus on the
Yeah.
things that will affect
right.
us in mass quantities if we don't keep you know, unfortunately, this Ebola has taken front and center in the media, and I just want to make sure people still pay attention to the flu, which is right in our backyard,
That's
and we
right.
are subject to it in this area, so,
And fastening their
Exactly.
seatbelts.
you know.
right, and heart disease, I mean, there's a
Yeah.
lot of other
Right,
more
exactly.
Washing their.
imminent
But right
things
now,
to worry
you know,
about.
Right, focusing on flu clinics and
Yep.
the importance of all of that is, all right.
Lyme disease,
Okay, I called Neshoba, and there were 3 confirmed cases last year.
Okay.
And that was in 2013. They don't have the stats for this year.
okay.
Okay,
So,
thank you.
there's that, and,
Interesting.
what else I just saw?
Tobacco permits.
Oh, yes,
Are-
that's what it
Those
is.
are going out, correct?
Yes. I'm just about ready. I'm learning how to do mail merge, and
You'll be ahead of me.
but I've got the stuff, and I plan to be mailing it out this week.
Okay.
And we have something with our new smoke shop. We have 14 people with permits, so I'll be mailing out 13.
Okay.
Okay, and we dropped one, correct? Woory?
I don't know.
They're still open? Did they stop selling cigarettes?
No, Woory is not
Oh,
open
you meant the
anymore.
market on the corner.
The market
They
we're
are.
near.
Okay.
I
I
they
don't
have
think
a-
they were.
They didn't-
on
They
They
didn't have a
weren't.
license? I
No.
thought they were on there with a
No.
license. Oh, okay,
No.
okay,
No.
okay.
So those
Okay.
should be your, I don't want to speak out of turn, Madam Chair. I
Well,
know
here's
you-
the list.
Yeah, let me just.
No,
take a
I don't
quick-
need to see the
I
list.
just want to take a
Okay.
quick look. We will look at these tomorrow, because I really want these to go out.
Yeah,
Yeah.
they
Soon.
probably should have, it
I
needs to
thought
be
we had
like the
already
number
talked
one
about
thing.
that.
We did,
Yeah,
we did talk about
okay.
it. Okay. Right, because Sandy's expires already in 2015, so, all right.
Yep.
Yeah, if they go out tomorrow, we have time.
Yeah.
It's 12:31.
Yeah.
So,
Okay.
and
Does anyone have anything else for miscellaneous here?
No,
Okay.
for the next meeting, I just wanted to remind you that it's time to for you to get the report for the town report ready.
Okay.
And that is always confusing because it's calendar year, so it's from
Okay.
January 2014
So
to
it's
December.
calendar year
Calendar year for
2014.
that.
Okay.
And you'll probably get something from the office in the first week in January and telling you so that's just
Okay.
an FYI.
Okay.
And with regards to trying to put together the budget for next year, if we could just get whatever the new rates are for the public spirit, because I think all
Yes.
costs went up, just so we have a ballpark, because we know we're going to be doing at least one public hearing and
That would be a good one, Jane. Can
At
you?
least one,
at least one.
because we're
Get
looking
the
at
rate.
solid waste regs and maybe tobacco.
Yeah.
Yeah. Well, I said at least
Yeah.
one.
Yeah.
Yep.
Yeah. Now, when Deb called to post her position, something very interesting happened. They quoted her, I was in the office with her and we were looking at the invoice from the last job posting. They quoted her verbally a rate that was almost double what last year's was. So we kind of startled a little bit, and then Deb said, well, we did this a year ago, and the rate was only such and such. And then they immediately said, oh, well, okay, then, so I'm not really sure what's going on there. I would also take a look at what our rate was for the last public hearing we did. And if we
Well,
get back
for
a quote
Vitasoy,
that's like
they-
twice that,
But
then,
Vitasoy-
But Vitasoy paid
Yeah.
their own, so we didn't pay for that.
I think that's a reasonable thing. You just get, what are your rates for an ad?
I know,
It
but you
must
see
be
what I'm
according
saying, though,
to-
Mary, that
I know the
think
costs
there's
have gone
a,
up.
right, I think there's a frequent flyer rate
Well, I
versus.
think there might just be a local town rate.
That could
That's
very
the
well be.
question that you could ask is,
Yeah.
I'm calling from the town of, the town of
Yeah.
Ayer. What is the going rate? Because if you're, looking at a municipality that posts upwards of dozens of public notices.
That actually might have been what it was. It might have been the difference between a municipality, so.
The
Yeah,
other
just
thing
make sure
is
they
if
know that.
you run it once, are you running it 3 times? So there's usually a break.
I think most of them are
Public hearing
twice.
at
right?
twice.
Yeah.
Yeah.
Okay. All right. Okay, then on that note,
Do we have anything on for the next meeting, Madam Chair? Anything?
we do
No.
not, other than we will have the budget.
Right, we'll look
And
at
we'll
the
have
And
budget.
we can
minutes.
start looking at,
Yeah,
yes,
no,
we'll have
that's
minutes, we'll have
fine. I just
budget.
didn't know, yeah.
I am going to try to contact Joan Hamlet again. There had been, I think she had a death in her family or a funeral or.
Well, I know she had when she was
something.
originally supposed to come, she did have a death, and then we haven't heard
Yeah, so I'm,
recently.
that I would say would be an update also for next week, is I will let,
And that's the tobacco.
yeah,
Okay.
let you know if I.
Are we going to have compassionate care?
Why?
When he's,
When are they opening? Does anybody know?
I don't think he's opening anytime soon.
No.
It's not going to be till after the first of the
Oh,
year,
okay.
as far as I know. We could, have him at some point, come and just update us on where the process is, but there isn't a,
I don't think there's
pressing.
any need for it right now.
No, he's not a
There's
pressing
nothing
need
going
at this
on.
point.
Okay.
I'd like to see it once it's open,
Once
just
it's
to get
open.
a walkthrough.
Yeah.
I know he's
Yeah.
always had his doors open.
Well, that's true. He has offered that if, I think he would do an appointment walkthrough if we really wanted that. That actually might be an interesting field trip for an upcoming meeting if we don't have anything.
Well, I've been over there
don't have
many
anything going
times
on.
already because he had open houses, and
Yeah, yep,
he was very good about that. So, until it's all ready,
okay.
and I
Yeah.
think they're moving at a snail's pace at the state level.
Yes, I think that is the
In
holdup.
fact, I think it's a stalled snail.
I think you might be right.
Oh, you know what, I had one thing for us to think about, only because I happened to be at a Rotary meeting about 2 months ago, and I met the new president up at the hospital. He came to speak with the
Yes.
Rotary. Sal Perma, I think his name is.
He's been at the
Yeah, for a little
selectmen's
while.
meeting.
Yeah. He actually gave me his card, and I don't think I have it here. Oh, look, I do. He offered to come speak to us if we wanted him to, but I thought maybe we could do it in like a slower, when we're not planning public hearings.
Yeah,
Yeah.
yeah, exactly.
I'm certain that, and when he did his presentation, and I don't want to take us any longer than we need to, he was talking about how he was really focused on kind of ramping up their staff as far as to address some of the things that they currently don't address. But I said to him he should address some of his community outreach, which I didn't think they were addressing either, getting a little bit
Exactly.
more involved and
Yeah.
being a partner with the town. And so I don't know if
Can I just write down?
yeah,
see
you
his
can
card
actually
so I can
have
just
that
write
if you
down?
want. I mean, that's
You
just.
can keep it, I just
all
want
right.
to write down.
But it just might be something, if we're looking at maybe planning meetings in the
Yeah.
spring or sometime, maybe midwinter or something. He spoke to the Rotary, and it was a low turnout, so it was actually quite a short and sweet presentation, which was perfect, to just kind of map out his vision. And I think he would grant us audience, of course, because we are his host community, but
Exactly.
also as the sitting board that regulates and oversees all of our own public health programs to
Could I see that too? So
Sure.
have a discussion with
Thank
him.
you.
Yes, actually, one of the things that, when I first came on the board, you may or may not remember, I was very interested in seeing whether the local hospital would do a
concerned about
career
the
day.
Career
with-
day for health
Yeah.
services.
And didn't really get much of a response there, so I think I might
He
try
may,
him
and it
again.
might be something that's part of that discussion is maybe, I don't know him, we didn't really have a comprehensive, I shook his hand, I took his card, I told him who I was,
Okay, and this was at a Rotary?
at a Rotary Club, because my
Okay.
husband belongs to Rotary, and Earl actually invited me to come simply because it was the president of the hospital, and he had heard us
Interesting.
talk about them from time to time in the past, and so. Anyway, so
Might
for
be a good time to
future-
look into that again.
For future discussion.
Okay, so for next week then, I will try to have an update from Joan Hamlet on what we might be able to do with tobacco. I will get the trash hauler regulations sent to DEP.
Excellent.
And I will, Mary, as a nurse, you might be the best one to ask. If I were to contact Neshoba to
got it.
talk about that, could they modify their form? What's the position of the person that I would want to talk to? Is there an ER administrator typically? Is that,
An ER?
yeah.
No, there's nursing service. You're
No,
talking
no.
about.
No,
the
no,
hospital,
at
to
the
the
Oh,
hospital,
you want
yeah.
to call up to the hospital to
Yeah.
talk to?
but I'm not sure who to even ask for. It's who actually, from an administrative standpoint,
So
kind
they've
of
made so many
does
changes.
policy
I know.
for an emergency room. Is there typically an emergency room administrator?
Oh, there's got to
There's
be
got to be a secretary, at least one,
Yeah,
if
I would
not
think.
more, because I'm sure.
Okay. So that wouldn't be a ridiculous thing to ask for, the ER administrator.
I don't know how you're ever going to get.
I know. I'm trying to think, if I were to approach this, if it were me, I would probably call a non-emergency number.
Yes,
gosh,
definitely.
And then I
Yes.
would probably say, I'm the chairman of the Board of Health and Air, and I'd
Yes.
like to discuss your process that you have in place for reporting animal bites, and open the door by having that discussion.
That's a good
Okay.
point.
Right?
Yeah.
And then say, I just want to discuss with you, for the folks watching at home, we do want to discuss with them their protocol. And
Yes.
then say, would you be open to making some modifications to your form to give our animal inspector a more holistic look at the incident?
Yep.
My marketing and my public health background just kind of
That sounded
merging
really-
together, but
Maybe you should make the call, Heather. You got a really good.
I think if you said you wanted to just review that protocol, who could you speak to?
Yeah.
And they may say, well, it's just whoever's on shift. And you may say, well,
Okay,
who manages the
okay.
creation of the reporting form? And then maybe
Right,
drill
right.
down from
Yeah,
there.
yeah.
It's a good
I
idea.
think if you called, when is it never an emergency at a hospital, right?
Oh,
But
I
certainly
know,
wouldn't
yeah.
call on a weekend or an
No,
evening.
no.
Maybe like
no.
at 2 o'clock in the afternoon on
That's
a Wednesday.
kind of what I'm thinking,
You know,
yeah.
or sometime when but I think
Yeah.
to open the door to say you could even tell them, and it's not, again, for the folks watching the home game.
Yep.
You could even say you're the new chairman. I'm the new chairman, I'm reviewing protocol, and we have a new animal inspector, and we just want to make sure we
Yeah.
understand.
Okay,
That's good enough.
all
I
right,
think so.
that sounds good. So I will also take care of that.
Okay.
And I will find out about walk and roll. And I think that
Yeah,
is
because I think I
everything.
starred that one.
Yeah.
I'm going to give it 2
Inspection.
stars this time.
Yes, please do, keep us on.
Yeah, well,
that.
I did call and I left both a voicemail and an email for Bridget, but then she had her mishap, and so.
Yeah,
Okay.
Okay.
Well, if you have
I think
nothing
that's-
else, I'd like to make a motion to adjourn.
So moved.
all in favor?
Aye.
All right. We will adjourn this meeting at 6:42.
We don't
it
have
looks
to
like.
lock up?
No.
We do not. We do not.
Okay.
See, now we're done.
So,
I know.
everyone.
Take those down. Heather, if you can just shoot me, Heather. Take it
We're
down.
fairly bored. We convened and adjourned fairly early.
Yeah. We're
That's how we
very
roll.
efficient.
That's how we roll. That's what
right.
we do.
Most meetings I get, they're at 7 o'clock.
Yeah, a lot of the meetings start at 7.
You are absolutely correct. The one thing I didn't bring a jacket with me tonight.
Oh, my
no.
goodness.
I mean, I'm right out behind you, Mary, so I'm not too bad, but.
That's cold.
Oh, that's right, you're going down.
Everybody